Hello, I am John Carney, and I have the privilege of serving as chairman of the PCOM College Board of Trustees. Thank you to our trustees, members of PCOM Alumni Association, award recipients and their families, faculty, staff, students, and alumni for joining us here today as we celebrate the founding of the Philadelphia College of Osteopathic Medicine. This year marks our 122nd anniversary of PCOM, and I could not be more proud to share this with you today.
Founders Day is a great tradition in our community and is celebrated the fourth Friday of every January to honor our legacy and our founders, Oscar John Snyder, D.O., and Mason Wiley Presley, D.O. Dr. Snyders and Presley founded PCOM in 1899 to bring the osteopathic philosophy of treating the whole person, not just their symptoms, to Philadelphia. On this day, the college presents its highest honors, the O.J. Snyder and the Mason W. Presley Memorial Medals, as well as the Alumni Association Certificate of Honor. Carol Henwood, D.O., 83, will receive the O.J. Snyder Memorial Medal, which recognizes leadership and service to the osteopathic profession and to the institution. The Mason W. Presley Memorial Medal is presented to students on both the Philadelphia and Georgia campuses for their outstanding achievement and service to the college, the community, and the osteopathic profession. Mr. Justin Kanakis, class of 2021, Philadelphia campus, and Ms. Akilah Raja, class of 2021, Georgia campus, are this year's recipients. Dr. Melissa Schwartz, class of 1991, will receive the Alumni Association Certificate of Honor, which recognizes distinguished services rendered and loyal devotion to PCOM.
It is my great honor to present Dr. Melissa Schwartz with the PCOM Alumni Association Certificate of Honor. This award was founded in 1971 and is the highest honor bestowed by the Alumni Association and recognizes distinguished service rendered and loyal devotion to Philadelphia College of Osteopathic Medicine. Dr. Schwartz is a 1991 graduate of PCOM and completed her general surgery and otolaryngology, head and neck surgery, facial plastic surgery residencies at PCOM. Currently, she owns and operates Montgomery County ENT Institute in Elkins Park, Pennsylvania. I have had the pleasure of serving on the Alumni Association Board with Melissa for several years and can attest to her dedication, determination, and unwavering support of the college. She is the embodiment of distinguished service and loyal devotion to PCOM. It's an honor to congratulate Dr. Schwartz on receiving the 2021 Alumni Association Certificate of Honor.
I want to start by thanking the Alumni Association Board for this honor. I am humbled to join the ranks of previous recipients, many of whom have been mentors to me during my time as a student at PCOM, and others who I have worked with over the past 20 years on the board. I have thoroughly enjoyed my involvement with PCOM and the Alumni Association over the past 2 decades. It all began when I received a letter from former President Dr. John Becker regarding an interest in becoming involved as an alum in the college. Apparently I answered correctly because a year later I was asked to join the board. I had no idea what to expect, but what I had hoped for was a chance to forge bonds with other graduates who felt as I did. That PCOM gave me a fantastic education, an opportunity to learn my craft and provide care to my patients with the unique lens of an osteopathic physician. I wanted to help impart this legacy to other young people and to help the college grow and succeed in the ever-competitive medical world. Of course, I was also excited because my classmate and anatomy table partner, Dr. Luke Nelligan, also served on the board, and I look forward to reconnecting with him. I feel the legacy of PCOM has been so rich and so impactful. For me, it started at birth. I was born at 48th and Spruce, the home of our hospital at the time. I was brought into this world via the hands of a DO. This DO and alum My late great-uncle, Herman Cohn, later told me stories about his early years in practice. He hung his shingle and charged $1 per visit, while the allopathic doctors in the neighborhood charged 50 cents. He had lines out the door and around the corner in just a few months. When he wanted to take CME courses in GYN, he was not permitted to do so as a DO. So he lied and registered as an MD. This grit, dedication to learning, and advancing in our field is what we are all about. Most PCOM graduates have no idea what the Alumni Association does. I certainly did not initially. And I will tell you that it has evolved over time. We are integrally involved in helping students and alumni with financial assistance for mission trips, conferences, research, and professional development. We are constantly building our volunteer corps for mentoring, research opportunities, and networking. We listen to students, we listen to the administration, and we strategize on how we can help PCOM thrive. We host parlor meetings, visit other campuses to lecture, and speak to student interest groups. During the current COVID-19 pandemic, many alumni have also given generously to the PCOM Student Emergency Fund. I encourage those of you who have interest to consider getting more involved. You will feel like you do not have the time, and you probably don't, but you will find it quite rewarding if you do. I must thank the PCOM Alumni Engagement and Advancement Office staff for their constant support over the years. Thanks also to the administration, who I've enjoyed working with over these years. Most of all, I must thank my family. My parents were excellent role models for community involvement, and to this day, my mother at age 91 is still involved with her synagogue. My husband Seth has been a constant supporter of my career and involvement at PCOM outside of being a super dad to our 3 great children. I will conclude with an excerpt from Lessons in Leadership by Rabbi Lord Jonathan Sacks of blessed memory. He wrote, "There is only one way to change the world, and that is through education. Children must be taught the importance of justice, righteousness, kindness, and compassion. They must learn that freedom can only be sustained by the laws and habits of self-restraint." Here at PCOM, we are educating health professionals in many disciplines, and they all have the potential to make a difference in the future. It has been my honor and privilege to participate in a small part of this process.
I'm honored to introduce Mason W. Presley Memorial Award recipient Justin Kanakis, a member of the Philadelphia DO class of 2021. Justin is not only an aspiring internal medicine physician, but a researcher, author, community volunteer, and leader. His commitment to osteopathic medicine is a family affair. His brother, Andrew Kanakis, is a 2018 graduate of PCOM and himself a Presley Award recipient. His aunt, Catherine Kanakis, is an internist and a PCOM alum from the class of 1983, as well as several other family members. Justin has served the college and his fellow students with distinction throughout his 4 years. He was selected to serve as a representative on the faculty admissions committee, interviewing and evaluating prospective students. Justin also worked as a peer mentor in the PASS program, assisting incoming first-year DO students with the transition to medical school. During his first and second years, Justin served as the vice president of the PCOM Gastroenterology Club, organizing academics and volunteer events for the club members. Despite these commitments and the significant responsibilities that accompany the medical school, Justin also found time to serve as a curricular coordinator for the Montessori Charter School after-school program and as president of Health Career Collaborative, a nationally recognized organization providing mentorship and guidance to high school students from underserved, underrepresented communities. Most notably, Justin was the founder and president of the Autism Health Awareness Project, which advocates for and strengthens relationships with autism spectrum disorder community of Philadelphia. It is now an honor to recognize Justin's work with the Mason W. Presley Memorial Award.
Dear PCOM family, It is truly an honor to stand here today as the recipient of the Mason Presley Memorial Medal. 4 years ago, on January 6, 2017, I interviewed at PCOM with Dr. Lanuti and Dr. Allison. I vividly remember their hard-hitting questions, ranging from why PCOM to what it means to be an osteopathic physician. 4 years later, I am now a member of the DO Faculty Committee on Admissions and have the opportunity to be on the other side of the interview table. Whenever we interview applicants, I reminisce to my interview and think about a question Dr. Lanuti asked me: what makes PCOM special? At the time, I thought I knew the answer, but as I wrote this speech, it's never been clearer. I would not be here today without the support of my family. Growing up, my dad would jokingly say, "The strength of the wolf is the pack, and the strength of the pack is the wolf." Growing up with my mom as a nurse and my dad as a physician, I knew the commitment a career in medicine would entail. Furthermore, having had the unique opportunity to see my brother complete his education at PCOM, I saw the rewarding challenges and opportunities that awaited me. During my first year of medical school, it became apparent to me that becoming a doctor was more than just memorizing the brachial plexus and the Krebs cycle, but rather most of the learning occurred outside the walls of PCOM, in the community, in the hospital, and connecting with patients. Building on this vision, I quickly became a member of the Health Career Collaborative and soon found myself as president of the club. Through this initiative, we set out to teach and promote health careers in underserved high school communities. It was in these classrooms I learned more than what a book could teach. I learned about the power of teamwork, the skills to be an effective and enthusiastic teacher, and the life lessons to be a more inclusive and compassionate physician. My experience with the Health Career Collaborative taught me the value of giving back under the spirit of altruism. I continued to be involved with community service and became president of the Gastroenterology Club, founded the Autism Health Awareness Project, and served on the DO Faculty Committee on Admissions. Through these experiences and bonds I formed, I started to realize that my wolf pack expanded beyond my family and extended to my peers and the people I connected with in the community. As I began clinical rotations, the excitement of interacting with patients taught me the power of teamwork. Each month, I found myself in a new hospital, learning a new specialty, and learning new skill sets. While navigating the clinical challenges of translating anatomy, physiology, pathology, and pharmacology to the bedside, the one thing that remained constant was the comfort of interacting with PCOM alumni in the form of residents and attendings who were always there to teach me. I learned how special the PCOM network is in supporting its students. One of my favorite rotations was my cardiology rotation with Dr. Christopher Drewgen, a PCOM alum. I was so amazed that he was able to craft simple, relatable analogies that helped his patients understand the complex pathophysiology of heart failure. Interestingly, Dr. Drewgen trained with my dad during residency in the early 90s and also taught my brother, who's the 2017 Mason Presley recipient, during his cardiology rotation. So, back to the question, what makes PCOM special? What I find so special is that my amazing experience is just one unique experience. PCOM is filled with tremendous opportunities where our students have the chance to create their own path and pursue their personal passions. Together, our unique experiences, dating all the way back to 1899 when Mason Presley was a student, serve as the foundation that makes PCOM special. As I enter the next stage of my career, I feel that my experience has helped me approach life with enthusiasm, creativity, and compassion. Looking ahead, I am confident that I have skills to be the leader, an innovator, and most importantly, an osteopathic physician that is a product of PCOM. Thank you so much.
I am also pleased to introduce Mason W. Presley Memorial Award recipient Akilah Raja, a member of the Georgia DO class of 2021. Akilah's commitment to the community, to her fellow students, to the college, and the osteopathic profession is unparalleled. In 2019, she was named the Medical Association of Georgia Student of the Year for her work in creating and hosting a panel discussion called Road to Recovery, which featured 5 individuals affected by substance abuse and an interactive question and answer session. In July of 2018, Akilah participated in the Summer Institute for Medical Students at the Betty Ford Rehabilitation Center in Rancho Mirage, California, which allows medical students to spend 1 week at the center, where she learned about addiction firsthand and from professionals as well as patients. Akilah worked to bring a chapter of the Gold Humanism Honor Society to PCOM, Georgia, a nationally recognized medical honor society with its 161 chapters established at medical schools across the nation. And the first members will graduate as part of the class of 2021. Additionally, Akilah is a member and former vice president of Sigma Sigma Phi, the Honorary Osteopathic Medical Society. It is an honor to recognize Akilah's work with the Mason W. Presley Memorial Award.
This is my first public speaking opportunity, so bear with me. However, being recognized as the 2021 Mason Presley Award winner is a great reason to conquer my fear of public speaking. I'm humbled and honored to be recognized in this capacity by PCOM and my peers. We all probably imagined Founders Day and the past year to be a lot different than it has panned out to be. We probably imagined being surrounded by friends and family, traveling to new places, celebrating accomplishments such as marriages and graduations in person, and not suffering so much loss, fear, or trauma in a mere 365 days. While it is difficult to find a silver lining to such a gray cloud, the humanity that has and will continue to arise from such trauma is truly remarkable. As a society, we have come together to support each other during times of social, economic, and scientific turbulence, and are working towards finding stability during times of uncertainty. I am proud to be a part of the medical community and work alongside so many wonderful healthcare workers whose efforts are truly inspirational. To memory, my earliest answer to the question, what do you want to be when you grow up, was, I want to be a paleontologist. This probably sounds far-fetched or fabricated to many, but I promise that it's true. This all started after I had watched an episode of The Magic School Bus, a show where an unconventional elementary school teacher named Miss Frizzle takes her students on field trips to various time periods or locations, such as inside of the human body to see how food is digested, or to the Cretaceous period to visit the dinosaurs. At 7 years old, I longed for the opportunity to discover the treasures of the earth while getting dirt under my nails and sand in my hair, a mom's worst nightmare. However, after a few years passed, a new passion had ignited within me. I had decided that I would become a teacher, just like Miss Frizzle from the Magic School Bus. This desire likely started off with simply wanting to spend time playing in a colorful classroom with other children, having lunch with my friends, and having 1 dedicated hour to playing outside per day. However, I'd like to say that it evolved into a desire to share my knowledge and experience with others. You're probably thinking, Akilah, you shouldn't pick a career based off how much time you get to play outside. Well, don't worry, I don't think doctors are known for how much time they spend outside of the hospital. However, something doctors are known for is their sense of discovery, compassion, and commitment to education. One could say, similar to a teacher or even a paleontologist. So my educational journey continued, and I found medicine as my calling. It encompassed all the things I loved about my childhood career goals and included some newfound passions, namely, working in a field that allows me to prioritize compassion and humanism. In fact, words such as sympathy, empathy, and compassion are so commonly used in medical training and practice, it is almost assumed that the definitions and nuances of these words are common knowledge. Yet, I am skeptical of how many people have looked into the actual definitions of these often conflated terms. To sympathize with someone is to feel another individual's hardship and express sorrow. To empathize with someone is not only to understand another individual's hardship, but also relate to their feelings and experiences. Finally, compassion encompasses aspects of both empathy and sympathy, but includes a goal of relieving an individual's suffering. As a physician, the focus of our career is to relieve the suffering of others, and when that is accomplished, we feel a sense of joy and purpose. However, compassion fatigue and burnout have started to plague our field due to obstacles to comprehensive patient care, such as time-consuming electronic medical records, inadequate insurance coverages, and accessibility to services, to name a few. Compassion fatigue is likely due to the fact that part of our goal as a physician is being threatened by these obstacles, and empathy without compassion, or in other words, relating to a patient's hardship without the ability to alleviate their suffering, is exhausting. The feeling of being equipped with all of the tools to do good in this world, but not having the resources or ability to implement that change, maybe even in your own loved ones, is exhausting. The reason I decided to speak so expansively about these aspects of healthcare goes back to something I mentioned at the beginning of this speech. We all envisioned this past year to be different. Regardless of our contribution to society, as a healthcare worker, teacher, business owner, grocer, parent, caretaker, or countless other fields, we have all experienced some compassion fatigue. And while this is a difficult situation for many individuals, I am hopeful that the spark of humanism within all of us will only grow brighter, and we will continue to support each other with the goal of alleviating each other's compassion fatigue and burnout. I would like to take the last few seconds of my speech to thank all of the physicians who took time out of their busy days to patiently teach me even the smallest fact with the intention of making me a better doctor. I'd like to thank the patients who vulnerably shared both their weakest and strongest moments with me. I'd like to thank those at PCOM who helped my projects come to life and encouraged me not to give up on my visions. I'd like to thank my friends who supported any and every new event, project, or idea I excitedly brought to their attention. And finally, last but not least, I'd like to thank my parents for teaching me, not only by philosophy, but also by example, that you really can do anything you put your mind, heart, and soul into.
This year's recipient of the O.J. Snyder Memorial Award is Carol Henwood, a 1983 graduate of PCOM and a 1985 graduate of the Family Medicine Residency at PCOM. Dr. Henwood has maintained a family medicine practice for the last 35 years and is the embodiment of an old-fashioned country doctor. She has a tradition of hugging her patients at the end of each visit, which has taken a pause in today's COVID environment and has taken care of generations of families. Dr. Henwood also works to unravel the maze of managed care and modern medical practice management and is passionate about helping other physicians navigate these issues. Her dedication and advancement of osteopathic medicine has been recognized by local, state, and national organizations. She expertly led the PCOM Alumni Association as its first woman president, as well as the Pennsylvania Osteopathic Family Physicians Society and American College of Osteopathic Family Physicians. Dr. Henwood provides mentorship and guidance to PCOM students, supporting several American Medical Women's Association activities and teaching as a faculty member in family medicine. Finally, there is perhaps no family in which PCOM runs more deeply. Dr. Henwood's husband, John Dada, is a graduate of the class of 1982. Their son, also John Dada, graduated in 2013. Other family members include her father, William Henwood, class of 1976, her brother, John Henwood, class of 1990, her sister, Maria Henwood Finley, class of 1997, and her sister-in-law, Jennifer Chimbada Henwood, class of 1991. It is an honor and distinct pleasure to award the O.J. Snyder Memorial Award to Dr. Carol Henwood.
Dr. Feldstein, members of the PCOM Board of Trustees, fellow O.J. Snyder Memorial awardees, and guests, I am humbled and honored to stand before you as the 2021 O.J. Snyder Memorial Medal recipient. My sincere thank you to the College Board for this great honor, and my sincere thank you to my family, colleagues, friends for your support over the years, without which I would certainly not be here today. There has been a recently released country western song by Rascal Flatts entitled How They Remember You. The gist of this song is not if you would be remembered, but how. I'd like to share a few of my memories. In 1979, I arrived at PCOM and had my first direct introduction into the profession that Andrew Taylor Still coined the science of medicine, the art of caring, and the power of touch. A way of evaluating the patient in a holistic manner, including the principles of OMM and OMT. Nicholas Dio, a giant of a man with gentle healing hands, demonstrated how osteopathic medicine made a difference in patients' lives. I wanted to have those healing hands. In 1981, in the infectious disease section of our internal medicine course, William Dickerson, DO, dedicated an hour to a recently discovered tick-borne illness in the New England area. Now, all of us all-knowing second-year students could not fathom why any of us would need to know something about a disease from Lyme, Connecticut. What we didn't know is that he was a reviewer for the New England Journal of Medicine, and we were likely one of the first medical school classes to hear a lecture on Lyme disease. This many years later, not a week and sometimes not a day goes by that I don't consider Lyme disease in my differential. I wanted to be able to impact physician lives as he had. And in 1984, as a family medicine resident, I met my mentor, Michael Avalone, Senior DO, as I began to be involved in organizational medicine. He was fierce and fearless and passionate about the profession and had an uncanny way of knowing the organization's need to change in the future. I wanted to be that kind of a leader. In 1979, there were 13 colleges of osteopathic medicine, and my class at PCOM of 204 students was the largest ever. Today, there are 37 colleges of osteopathic medicine with 58 campuses, and 1 in 4 medical students in the United States are attending osteopathic medical school. Osteopathic medicine has enjoyed much success and faced many challenges. But I submit that we are facing our greatest challenge ever today, the single accreditation system, an effort that began in 2014 and has reached full implementation July 1st, 2020. The single accreditation system merged our osteopathic graduate training programs into the ACGME system. This may have allowed better access to certain training programs and the opportunity to expose our MD colleagues to osteopathic medicine, but the end result was no distinctive osteopathic programs. Processes and rules beyond our control may cause our osteopathic graduates not to seek osteopathic board certification, and it threatens osteopathic distinctiveness and identity. George Northrop, DO, from California in the 60s, when there was a movement to change our designation to MDO, said this: "Now as then, the threat to our profession is loss of identity, loss of the belief in the special and unique nature of osteopathic medicine. Without that identity, the profession cannot survive. With it, the potential is unlimited." This could not be more true today. The song says, "Will you stand or will you fall?" I say, we can stand together to preserve our osteopathic profession. In practice physicians, I urge you to continue to be proud osteopathic doctors, and regardless of specialty, continue to embody the tenets of holistic care on which A.T. Still founded the profession. Have healing hands. Know the most current science. Remember that caring is an art to be held sacred. The American public deserves to have a DO as their physician. Educators, both at the colleges of osteopathic medicine and postgraduate level, I thank you for what you do every day. What you do today for the role in modeling the future osteopathic physicians, instilling the osteopathic tenets, and affecting their lifelong practice of medicine. What you do today will bind them to osteopathic medicine, make them high-quality physicians, and allow them to contribute to our future. Residents and students, know that you are our future. I challenge you to continue your road in osteopathic medicine. Know that many have worked to assure that your road will be less rocky than the one that they have traveled. Choose osteopathic board certification, celebrate our distinctiveness, and be that fearless leader that others will choose to follow. We will stand. We will not fall. We will preserve and celebrate our osteopathic distinctiveness and our identity. Let this be how they will remember us. I will close with what has been referred to as my tagline. Today is January 22nd, 2021, and it has never been a better day to be an osteopathic physician. And if you ask me tomorrow, I will say it is January 23rd, 21. and it has never been a better day to be an osteopathic physician. May we all be able to say these words forever. Thank you.
Mother, I'm so proud as you accept the O.J. Snyder Memorial Prize from the Philadelphia College of Osteopathic Medicine. This distinct honor reflects your stewardship of the osteopathic profession, your partnership with patients and families for better health, and your dedication to healthcare innovation in the delivery of high-quality, cost-effective, patient-centered care. Throughout my life, you have remained an inspiration, both professionally and personally. And now, as I craft my course in osteopathic medicine, I reflect on your passion for life and your passion for service on a daily basis. Mother, I wish you great joy on this magnificent occasion and cannot wait to celebrate with you in person very soon.
Thank you for joining us, and my sincerest congratulations to all of our award recipients. Your service and support of the college and the osteopathic profession make us all proud to be part of the PCOM community.